All right, well, congratulations on making it this far in your care. We're almost done with your initial phase of care. And over the next either weeks or couple visits, you and I are going to be having some discussions about what's next for your health. And what that means is what's it for you to live your healthiest, to stay at your optimal level of health, live at your healthiest potential, not only today and now, but the rest. Most of my patients at this time in their care, they'll ask me if we offer any type of maintenance care. And we don't offer maintenance care, and I'll explain why we don't do that. But what patients really mean, or just the sentiment behind maintenance care, is they're asking, what do I need to do to really prevent myself from relapsing to the person I was, or the health that you were when you first came in the office? And that's a valid, pursuit. It's a valid question to ask. The reality is, if you do nothing to pursue living healthier and staying at your healthiest potential every day of your life, by default, you're going to disease, you're going to lose your energy, you're going to gain weight, you're just going to be unhealthy. You're not going to be able to function in life and deal with stress. It takes effort, it takes energy, it takes focus to live a healthy life, and something we all need to do if we want to be able to live our healthiest life and live at our healthiest potential. So that being said, what's it going to take for you to be your healthiest? And what we're going to be doing here in either a day or two is I'm going to text you out a questionnaire, and I want you to take 10 minutes to answer the questions that I'm going to send you. And I want you to really think about the questions. They're going to be asking you things like, what are your health goals? Why they're important to you? Where does your health impact, the rest of your life? The reality is, most people don't consciously think about living a healthier life and have a goal or a plan and how they're going to do that. And most people never think about what it means to be healthy. Unfortunately, a lot of people wait until their health is gone and then they start thinking about these things. And so I want you to take the time to sit down and really dig in and give me some detailed answers. I don't want just surface answers about what's important to you when it comes to your health and your life and what that all means. I want you to really think about it. So take some time to think about that. And I want to give you an example, for me personally. If someone were to ask me, why do I want to be healthy, or what are some of my goals? One of the things that would come up is I would talk about wanting to be able to work out 5 days a week for as long as possible, for sure into my 60s. So that's a goal I have right now. And there's certain types of workouts I really enjoy doing. So that's a goal. So on the surface level, we have a goal there. But what I really want to do is dig into, well, why is that important to me? And there's a lot of reasons. So if I start down that rabbit hole of answering that question, I would say, well, I'm more joyful, I'm more positive, I love working out, so it helps my mindset. It impacts me when I come to work. I have great energy levels. I'm able to help more people because I can be more focused. My body's not in pain. I can function better, so I can be a better doctor, which means I get people better results, which means as those people get healthier, they go into their lives and their communities, and now they can impact people. It means I can be a better boss. I can run my business better just by working out and being healthier. My mind works better. When I go home from work at the end of the day, I have plenty of energy to go play with my 4-year-old daughter. I can hang out with my wife. I'm in a good mood. I'm not crabby. I'm not frustrated. All these benefits that come from being physically fit. Now, on top of that, I sleep better. I like that my clothes fit. I don't have to worry about gaining weight. These are all the benefits. And if I dug into each one of those benefits, I could go even deeper into why that's important. So for example, I sleep better. Well, why is that important? Well, I wake up refreshed, which allows me to work out. And when I sleep better, I give better treatment to my patients. I'm nicer to people. I'm more focused. So that's what I want you to do, is really dig into what you want, how you want to be healthier, and what that means for your life. And then lastly, the reason why I don't offer maintenance care, we talk about living at your optimal potential, your ability to function at your highest level with your health. And that's going to consistently change. People who try and maintain their health, or worse, do really nothing to be healthier, but just maintaining your health means you're not going to be able to deal with the stresses of life. Now, I can guarantee in the next 12 months, you're going to go through some challenges. I will, you will, everybody will. You're going to go through mental stress. You're going to go through traumas. Maybe you're going to lose someone you love. You're going to go through physical stress. Something's going to happen. Just look at the history of your life. Things happen in life, and we're going to have to rise to those challenges of those stresses. And the person who's just maintaining their health, they're going to get beat down by that stress. They're not going to be able to get through it. They're not going to be able to thrive. And they're going to come out the other end sicker, degenerating, less energy, and not able to function. And so when you start choosing to live at your optimal level of health, of living at your healthiest potential, you're going to be able to deal with the stresses of life that are coming. And I guarantee they're coming. And if you reflect on that, I believe you'll agree that that's going to happen. Challenges are going to come in our life. So I want you to take some time when you see the text message, when you see the questionnaire, to just sit down and really think about what it is you want for your health, how that impacts your life. I'm going to look over all your answers, and then you and I are going to sit down. We're going to have a discussion about what it's going to take for you to live your healthiest life, what that means chiropractically and in other areas of your life. So at this point, I want you to just know I'm grateful that I've been able to be your chiropractor thus far and to serve you and to help you reach your health goals. And I'm looking forward to a great future with you. I'll see you soon in the office. Take care.